Mom. I'm your host, Natasha, and this is the show that helps you have a voice, real moms and dads sharing the unedited truth, finding joy in the chaos, and reminding each other that we're in this together. So, this would be episode 14, and we're going to talk about vaccines. So, this one will be called Everything You Need to Know That You Never Wanted to Know. So with the vaccines, we obviously have to use the information that we have available. So we'll discuss each individual vaccines, what they do, what the purpose is, like what the disease or virus causes, and if the vaccine fully can eradicate that or keep you from getting it, etc. This all obviously comes from the CDC. We have to use the information that we have available to us, but obviously, I do in the end feel like it's each individual, parents and families' right to choose whether they vaccinate or not, what's right, what's wrong, who, I don't know, you know? Uh, so with this, we'll also discuss myths about vaccines because there is obviously a lot about those. The only one that we won't discuss about is the COVID because that's so new, and I just don't feel like they have enough information to say that that is safe or, much about that one. So we'll kind of discuss a lot of the tried and trues. There are a couple new ones on this list, but in general, the tried and trues, and this is generally for babies and toddlers, is what we're going to discuss. So one of the very first ones that they list through the CDC, they give you a whole chart that you can look up. This is what we use in clinics and decide what you need and what you've had and what's due next, etc. So you can actually download that for yourself on the CDC, and it'll give you exactly what their schedule is for it. So this one goes from birth to 18 years old. And then there's a whole different set of guidelines for adults and all of that. So with this, the very, very first one on here is RSV, which is respiratory syncytial virus. The first dose is generally given to the mother if you accept that. So the goal is that the mother passes the immunity on to the baby. I did receive this vaccine when I was pregnant, and I was honestly really, really scared about getting it, and everything was fine. I honestly didn't feel anything. My arm hurt like a tiny bit, but felt fine. So no issues for me when I received this. And then on here it says the next dose. It says one dose that should be given between 8 months and 19 months. So can kind of split that up if you wanted to. So that since they already get so many vaccines. So with this virus, it is a respiratory virus. It infects the nose, throat, and lungs. It is similar to COVID and flu, and that's why it's so important that we test for each one. Obviously, there is medications for some of them that can help you feel better and then not for all. So they do test to kind of see which one it is to see how they can best help. This one peaks in fall and winter, and the worst months are December and June, which makes sense. This is obviously worse in infants and the elderly because they are more fragile than, like middle-aged adults and uh, younger adults. So, part of this is that it can cause secondary infections like bronchitis, which, if you're not familiar, is an inflammation of the small airways and lungs. It can also cause pneumonia, which is an infection of the lungs, and that can become very serious. You might need oxygen, fluids, or intubation, which, if you're not familiar, intubation is when you have a breathing tube put in to help you breathe. So, this can make babies very, very sick as well as like the elderly, like we discussed. So, good things to keep in mind is that it spreads through cough, sneezes, and touch, and it does stay on surfaces for a certain amount of time as well. I'm not quite sure for how long. So, good hygiene is very important, and then wiping down surfaces a lot. So, I know that we're always, I'm always cleaning Odin's toys, and he doesn't really have any exposure to other kids, but we're touching things, and So constantly wiping things down, and making sure we wash our hands. So if we ever have anything like on our hands, he doesn't become exposed to it when we touch him. The very first vaccine that they're supposed to get is when they're born. So that is the hepatitis B vaccine. So they generally recommend that they give you the first dose at birth, the second one between 1 and 2 months, and then the third dose between 6 and 18 months. We did, as a couple, decide to hold off on that for Odin until he was a little bit older. We just didn't feel like it was necessary that he get a vaccine like that right when he was born. So that was a choice that we made. We're still going to get it for him because we do understand that it is important, but we personally did hold off on that right at birth. We didn't feel like that was necessary for him to have. So hepatitis B, um, causes a liver disease by the Hep B virus. Um, it can be acute or chronic. Acute is within that it's just within 6 months, and then chronic is after that. 1 in 2 people are infected and don't know they have it, so that's good information to know. It is spread by infected blood and body fluids. It has to be treated. Can cause liver damage, cirrhosis, liver cancer, and obviously worst outcome is death. Many people won't have symptoms until it becomes chronic. So in the acute stage, they really don't notice it. So once it starts damaging the liver, then they start to get dark urine, clay-colored stools. Some people report feeling tired. They can get fevers, joint pain, loss of appetite, stomach pain, nausea, vomit, jaundice, which is a yellowing of the skin and eyes. So this one, I do feel like it's important, and especially in this day and age where things are, kids can be exposed to things. I feel like this one is important to have, to prevent that disease. The second one on this is rotavirus. And this one, they give the first dose at 2 months, the second dose at 4 months, and then there's some recommendations at 6 months if needed. So I do believe this is one of the ones that there's a 2 dose or a 3 dose series. So up to your provider how you kind of proceed with that one. But rotavirus is severe diarrhea and vomit in infants and children's. They can treat the symptoms, but there's no cure if they do get it. Symptoms start within 2 days and they can last anywhere from 3 to 8 days. That they will have fever, stomach pain. They can end up with dehydration, which is a major concern, especially in babies because they're so fragile. Ways to tell if your baby is dehydrated is if they're crying and there's no tears, if they have dark colored urine, um, they're not sleeping, they're fussy, they have a dry mouth, lips, tongue. It's hard to describe that, but as soon as you saw it, you'd know that they just look chapped, and the tongue literally looks dry. So, good things to watch out for if they are having any vomiting, diarrhea, etc. A lot of this spreads pretty quickly through hospitals, daycares, and then families because you're constantly around each other. It is spread from feces, so poop. So that's gross. So the particles are you generally left on like unwashed hands, so it's very important you have good hand hygiene. And like those particles don't even necessarily have to come from you. It could be you touched your grocery cart and then you touched your baby. So just really important to watch those types of things. It is very infectious, so it spreads quickly, and the symptoms are the worst in the first 3 days, it says. So this one definitely helps the babies prevent any of that, and kind of avoid that, but it is because they're so, so little and stuff that the risk of becoming dehydrated is so high. And like with babies, you can't just, be like, here's some water, here's this, da, da. It's harder to keep them hydrated too. The next one on the CDC's list is the diphtheria, tetanus, pertussis vaccine. So that's the Tdap for kids. When you get older, you end up getting you get different vaccines, but for the kids, it's Tdap. Um, and so each one of these is a separate issue. So diphtheria, um, but this one is so sorry. This one does come in all in a one vaccine. They give the first vaccine at 2 months, the second at 4 months, and the third dose at 6 months. And it does have a recommendation for a fourth and fifth dose. Um, so that is definitely something to discuss with your provider. It looks like fourth dose around 15 months, and then a third dose around 4 to 6 months, and then I'm guessing, or 4 to 6 years old, and then I'm guessing it's like that every 10 years after that or so. I think it's 7 to 10. So diphtheria is a toxin of bacteria by strains of the virus. Is most common, affects the respiratory tract, and then the secondary infection that it can cause is skin infections. Respiratory symptoms begin within 2 to 5 days. There can be a mild fever, sore throat, swollen neck, weakness, and then issues with the nose and throat, which had already said that you might have a sore throat, but definitely probably like nasal congestion. The skin will have open sores sometimes, and you'll end up with like a pain, a rash around it, peeling, red, swelling. The worst case for these is that they can cause kidney failure, myocarditis, neuropathy, and then it says that one in people die from this. Um, it spreads by close contact with someone who is infected. If you share any respiratory secretions, you're exposed to their wound. They cough, sneeze, touch. So, again, surfaces, all of that. So, very important for good hygiene. And if you're not feeling well, obviously stay away from those people. But yeah, so this one in 10 people can die from. Tetanus, there is um, it's actually a very serious virus that's found in the environment. It generally appears in the between 3 and 21 days. One of the first signs of it is lockjaw. So, like, you literally won't be able to move your jaw, trouble swallowing, sudden involuntary muscle spasms, stomach. It says that the stomach is one of the main areas that you might get those muscle spasms in. You can have pain in all your muscles. You can have seizures, headaches, fevers, sweating, increased heart rate, and blood pressure. Worst is the throat and vocal cord tightness. You can have a PE, so a pulmonary embolism, which causes breathing issues and can be very serious. You can get aspiration pneumonia, and for this one as well, 1 in 10 die. The tetanus that we kind of think of, I feel like, is that we know that if we like cut ourselves on something or we're bitten by an animal, you generally need an updated tetanus shot. So one of these is wounds that are deep, that are dirty. You cut yourself on something that's rusted or metal, very serious, and you definitely need to seek assistance for that. Risk is definitely worse in the elderly, those that are diabetic, immunocompromised, IV drug users. So it's important to kind of, if you are immunocompromised or one of these, like an elderly person or something, that you definitely make sure you follow up with your provider to get vaccinated. The tetanus spores get into the skin, so you want to make sure that if you do cut yourself, that you clean that wound right away. Obviously, like I said, go to your provider, get that updated booster. Um, Worst is obviously if your wound is exposed to poop, feces, saliva. A puncture wound is bad, dead tissue. So, all of these things kind of lead to the worsening of the infection. So, very important to seek an evaluation and to make sure that that wound is taken care of. So, one of the things that the doctor might get for you is wound care as well. Pertussis is whooping cough. So it's literally when you hear someone, I've only heard it once, but they literally like sound like they're like whooping when they cough. So it's really intense and it looks very painful. It's like they're like a sound once you heard it, you couldn't forget it. But they're like gasping for air. The symptoms begin between 5 and 10 days, but they can last up to 3 weeks. They get runny nose, stuffy nose, low grade temp, cough. Babies really struggle to breathe with this, and it can last up to 10 weeks for them. They can vomit, become really tired, have difficulty breathing. The coughing can be so severe that they can actually fracture ribs. Um, it can cause apnea, which is like ceasing of breathing for a short period of time. They can end up with pneumonia, encephalopathy, convulsions, and 1 in 100 can die from this. The treatment for it is they may need antibiotics for that secondary infection, and many just need hospital care to assist with like breathing and fluids and to relieve those symptoms that they're experiencing. And obviously, the ages that are worse again are children and the elderly. So, very important that they receive this vaccine. So, this one's nice that it comes all in one and it can prevent all of those issues. Then we have the influenza. So, we're all very familiar with this one. So, this one is for the type B. They give the first dose at 2 months, second dose 4 months, third dose, it says C notes, but the third and fourth dose, it looks like they give around 12 to 15 months. So I generally think this one is like a two-step one. So this one does cause many types of infections, some that are mild, some that are serious. The more serious ones that it can cause is pneumonia, bloodstream infections, meningitis, epiglottis, cellulitis, infectious arthritis. Some of the more mild infections that it causes are ear infections and bronchitis. Symptoms could vary depending on which one you get, but can include fever, chills, cough, fatigue, shortness of breath, headache, and chest pains, muscle pains, aches, pain in the belly, diarrhea, nausea, anxiety, stiff neck. It can cause the person to be irritable, have abnormal refluxes. It can also cause brain damage if it's like an infection of the blood. It can spread. It can cause the loss of limbs and hearing loss. Antibiotics are needed. They may need breathing support. It can and to help with like low blood pressures because that can be part of the issues. Wound care if they have any open wounds. So this one definitely can be very serious. And the next one is pneumococcal. So this one is the pneumonia vaccine. So this one, the virus literally causes pneumonia, can cause ear and sinus infections, meningitis, bacteremia. This one is worse in infants and children, and then those 50 and older. So there are guidelines for children and adults for these as well. Adults usually get different vaccines, but this one, it looks like they recommend the PZV 15 or PZV 20, first dose 2 months, 4 months, 6 months, and then the fourth dose between 12 and 15 months. So they obviously get a lot of vaccines at 2 months, 4 and 6. So it's a lot all at one time. But this one, for pneumonia, the symptoms are going to be fever, chills, cough, fatigue, shortness of breath. You can have AMS, so that's just altered mental status. Treatment for this one is going to be antibiotics if they were to get it, and supportive measures, so treating it, the fevers with Tylenol and, helping them breathe if necessary, etc. So this one's very important as well. Then the next one is, I feel like, one of the most important ones that you could get for your child, which is an activated polio virus, also called IPV. They get the first dose at 2 months, second dose at 4 months, and then the third dose at 6 months, and a fourth dose between 4 and 6 years old. So this so poliovirus affects the nervous system and can cause flu-like symptoms, can cause brain inflammation, and in severe cases cause paralysis, can cause permanent paralysis or even death. Children can later develop new muscle pain, weakness, or paralysis as adults. So even up to 15 to 20 years later, they might have not had any issues initially, and then later it can come back. The virus just kind of lays dormant, and then it can come back and actually cause that paralysis. And it's not that they, had a new infection, it's just that it activates at that time. So it says 2 to 10, which I think is an odd range, but 2 to 10 children out of 100 die from this. So with this, it gives 99% protection if you get the vaccine. So that's pretty good odds for that. So I feel like that is honestly one of the most important. If you've ever met anyone, I met a couple older people when I was taking care of patients that had polio, and they both had not had any issues when they were children, and then 15 years later or so, they ended up having some pretty severe issues. So very important one. Like I said, we're not going to discuss COVID and then the flu vaccine either. The things that I just want you to know for those, if you do choose to get those, there is a misconception that they are not going to, it's like, like the polio vaccine, 99% effective, you're not going to get it. With the COVID and flu, the goal is only to lessen your symptoms. It's not going to stop you from getting COVID or the flu. It's just supposed to keep you from getting so sick that you end up in the hospital. So please be aware of that. It does not stop you from getting those. The next vaccine, which is another pretty mainstream one that has been around for a really long time, is MMR, which is measles, mumps, and rubella. First dose they get at 12 months, and the second dose they get at between 4 and 6 years old. So this one will have to break up as well because they are all different. Measles causes a high fever, rash, cough, red eyes. It's very, very contagious, can lead to brain inflammation, and also can cause pneumonia. It is the same as German measles. So if you hear, oh, they have German measles and I don't have regular measles, no, they're all the same thing. So same. There is no treatment or cure for it, so they're just going to treat your symptoms as best they can. You may have a barky cough, like I said, red eyes, stuffy nose. You're going to be very tired. You can get white spots, um, smooth rash. You can get diarrhea, vomiting, sore throat. It is airborne, so it comes from when someone breathes, coughs, sneezes, the little particles. It does stay on surfaces as well, so things that you touch, it does live on there, so you can be exposed that way. Risk is for which I thought was funny. So it says that anyone under 5 and those that are 20 and older are at high risk. So, also compromised and pregnant people are at really high risk. Complications can be ear infections, dehydration from the diarrhea, and the vomiting, bronchitis, laryngitis, pneumonia, blindness, brain swelling. Uh, and then there's a couple things that are called like SSPE and MIBE. And these ones have really, really long names that I honestly don't think I could really pronounce, but they do affect the nervous system and can happen days later or years later. So it definitely can cause complications later on as well. Obviously, worst outcome for this is death. Usually it lasts between 10 and 14 days. For those with severe symptoms, they will need to go to the hospital. Um, for mumps, it's a viral infection through saliva, causes painful swelling of the salivary glands, causes fever, malaise. Severe complications can be swelling of the testicles and ovaries, which I thought was interesting. It can cause brain swelling as well, pancreatitis. The symptoms that you'll experience is swelling of the jaw, fever, you'll be tired, have no appetite, headache. So, about 2 weeks for recovery, but it does take up to 2 to 4 weeks for this one to show up. Everyone is at risk for this one, and it can be complex for everyone. It says it can range from mild to severe. And then this one also doesn't have a cure, but they focus on treating the symptoms. Rubella is like a rash. So that one, it can just be very uncomfortable. So this one also is included in this. And I didn't generally see a whole lot of information about this one, but it did say that it can cause a pretty severe rash and just be very uncomfortable. So good to prevent that one as well. The next one on the list is going to be varicella. So chickenpox. The first dose for this is going to be at 12 months and then the second dose at 4 to 6 years old. Chickenpox is very contagious and it's mainly by contact. It's a blistery, itchy rash. Usually lasts 4 to 7 days. It's really bad if you are pregnant and babies, children, those that are weak, so like the elderly, or have a poor immune system. The infection rate is 90%. So if you come into contact with someone, 90% of the time you are going to get it. Symptoms after exposure start within 1 to 2 days. You are contagious until all of your blisters are scabbed over and you haven't had any new spots for 24 hours. The bad thing with chickenpox is then later, so if you get chickenpox, then later on you can be at higher risk for getting shingles, which shingles is very painful. It's like a patchy rash that affects the nerves, and I've heard it's a very, very painful. So ways you can contract it, chickenpox is from being around someone with blisters, breathing in the particles. It can take up to 10 to 21 days to fully get rid of everything from your system. The goal for treatment is relieving the itching. So there's like calamine lotion and then oatmeal baths, antiviral meds. So, but this one's can be very painful and it generally can't get it again. There are people that have really weak immune systems that have gotten it twice, but generally, it's a one time thing. So sorry. Hepatitis A is a liver infection caused by the hepatitis A virus. It's spread person to person. This one's well known because you can get it from food and drinks. You can feel sick for weeks to months. Can cause liver failure and death. So that's scary, obviously. For this vaccine, it's a two-dose series that they get between 12 and 2 years old, it looks like. So, two different doses to prevent this one. The symptoms of hepatitis A virus are dark urine, clay-colored stools, diarrhea, tired, fever, joint pain, loss of appetite, nausea, stomach pain, and jaundice. Anyone can get it. Transfers even with a very small amount, so just even a tiny amount in your food or drink, and you will become infected. The goal with this one, there is no cure, so it's to treat symptoms, rest, have a good diet, and drink fluids. They also list the Tdap on here, which we already talked about the DTaP. So the Tdap is for anyone 7 and older, so we won't discuss that again. But it does look like they recommend that first dose around 12 years old. The next one is the HPV virus series. So this one is the human papilloma virus. Can cause cancer later. It says around 42 million people are already infected and 13 million new are infected every year. So this one is spread through skin to skin, sex, oral sex, vaginal sex, anal sex. Most have no symptoms. Some strains can cause warts though, so that would be something noticeable, but otherwise most of the viruses just kind of hang out in the body. 9 out of 10 of these viruses can go away on their own, but there are so many different strains. I can't even remember how many there are now. I know it's upwards in the 200s, I do believe. But some of the strains can cause cancer, and that's definitely concerning, as well as the ones that cause warts. There's no cure for. They can try to suppress it, but once you have it, you have it. It's not something you can get rid of. So the HPV series, if it's something you want to do, you can get it for your child. And I it just says see notes on here, so I'm guessing when they get a little bit older and maybe closer to those sexually active years or something that they're thinking about, maybe that's when you get that one. But definitely concerning, and if you can prevent that, especially because a lot of the strains can cause women to get, cervical cancer and things like that. Then we have the meningococcal. This one is Men A. So we'll discuss meningococcal A and B. So it's a meningococcal is a disease for any infection caused by the bacteria. Oh my goodness, Neisseria meningitis. Most common are meningitis and bloodstream infections. Meningitis infection, the lining of the brain and the spinal cord, which causes swelling, so that's scary. For this vaccine, it looks like they recommend the first dose between 11 and 12 years old, and then the second one around 16 years old. But if it gets into your bloodstream, it can cause damage to the walls of the blood vessels and causes bleeding into the skin and organs. It's just super scary. Symptoms can vary. You can get fever, stiff neck, nausea, vomiting, confusion, headache, light sensitivity. 1 in 10 have it in their nose and throat and don't get it. But close or lengthy contact, i.e., kissing, living together, you can get it twice, but that is rare. It says can be difficult to diagnose because the symptoms are so vague. So definitely important to kind of monitor those symptoms. It says that you may need antibiotics too, kind of based on which one you get and how severe that you get. So those are the main ones. Um, so we'll go through those again. The ones they recommend for babies, since birth till 18 years old: RSV, hepatitis B, rotavirus, Tdap, um, the influenza type B, pneumococcal, the IPV, so the inactive polio virus, measles, mumps, rubella, so the MMR, the varicella, hepatitis A, and then HPV, and then the meningococcal vaccines. So those are the main ones, but they can definitely, obviously, it can be a lot, and they do really get a lot at 2 months, 4 months, and 6 months. So I feel like that's hard because they're so small, and it's scary because you're giving them things. But a lot of these for me, Kristen, I discussed at length. And they are like the tried and true vaccines that have been around for so very long. And, we really, I personally wouldn't ever want him to get any of these, and he has been fine thus far with the vaccine. So we've been very, very thankful for that. So then we're going to talk about some myths with vaccines. This information I did find from the American Academy of Allergy, Asthma, and Immunology. So, some of the things on here. So, one of the myths: vaccines contain harmful ingredients, which I'm not going to lie, this is one of the concerns I had with giving vaccines too, is like what's in them, what fillers do they put in them, that my child's going to be exposed to. So this, it says virus vaccines do contain various substances that are considered safe and are said to be ingredients that we are exposed to in the environment. So for example, mercury is used in aspirin as a preservative, but now none of the vaccines have it in it. As of 2025, they were going to take mercury out. So that's not something you have to worry about being in vaccines, which I have heard of. This is one I've never heard of, which made me nervous when I had it heard it was in there, but formaldehyde. They use it as an inactive agent, but it also is they use it as an inactive agent in the vaccines, but I didn't realize that they also use this in household products, furnishings, paint, makeup, cough drops, antihistamines, and mouthwash. So, just so you know, that's in there as well. I thought that was interesting. Aluminum states helps boost and build a stronger vaccine. Not all vaccines have it, but amount is less than found in food and water. So they're saying that you take more in from your food and water than you would from their vaccines. So take that as you want. That was always one of my concerns too, is the fillers that they use, not just the the actual vaccine part, but like what fillers do they use. Another myth: vaccines cause autism and SIDS, which SIDS is sudden infant death syndrome. It says science has not determined any cause for these. So I know this is a very controversial subject, and at one point there was something that was published like connecting autism and vaccines, but then that study was disproven and had a lot of errors in it. So I feel like that's a hard one because you don't want to do anything to your child that's going to cause them, issues later in life. But they're really, as of right now, and according to, like even like the CDC and everything, there is no correlation between vaccines and these issues. I had never heard that it was connected to SIDS before, so I found that interesting that this was on here, but it does say there's no link with that as well. Another myth is better to get immunity from the disease and not a vaccine. So with that, you have to think like benefits outweigh the risk. So the vaccines are going to allow your body to make antibodies so that you either A, don't get it, or have a better chance of fighting the disease off. If your child is exposed, like that's like a controlled amount, right? It's a controlled, um yeah, it's a controlled amount. It's in a controlled environment. It's not going to cause the actual disease itself. Like none of these are going to cause you to get the diseases. Um, so I think that's important to know that, if you do, because I heard about the chicken pox parties and the measles and whatever, and you're putting your child at risk for getting those severe complications. And I think that's just really important to think about if that's something that you're thinking about, that those severe complications do happen. And, we do have a good healthcare system, but there's also only so much they can do. So I think that's important to really, really think about as well. Not that I'm pro-vaccine or not pro-vaccine. Obviously Chris and I spent a lot of time talking about things, but yeah, really thinking about what those complications can look like if they were to get the disease. Don't need to vaccinate my child if others are. So I have heard that before, that, since they feel like the majority of children are vaccinated, that they don't need to get their child vaccinated. That's not necessarily true. You can still, be around those that aren't vaccinated, or those that are infected, and then they're going to end up getting that as well. So I do understand herd immunity, and it does decrease the risk, but it does not prevent them from getting the disease. So very important to know. Another myth: you can get the disease from the vaccine. So most of these vaccines are inactivated vaccines, so the virus is not live. So it would be impossible for you to get the disease from the vaccine because they are inactivated. There Some of them, it does say, with like the live vaccines, you might have a chance of being able to get a mild case of the disease, but you never get like the full blown, like if you were exposed to it. Example is chicken pox. You might get a rash, but that's just showing that your body's working. But you wouldn't get like the full body blisters and be contagious like you would if you actually got chicken pox. So the live vaccines can cause a mild case of the disease. There used to be an oral polio vaccine, which I didn't know, and they did stop giving that in the US because it could mutate and cause polio. So they did stop giving that here. From what I could see, it does look like they may give that in other countries, but they do not give that in the US anymore. So that is good. There was a whole bunch of myths, like I was reading about like the COVID vaccine and the flu vaccine and stuff. And like I said, don't want to go too far into those because those aren't ones that I super believe in on my end. But I do believe in a lot of these tried and trues for prevention. So this is just kind of a quick rundown for you about what each of these viruses are, what the vaccine's purpose is, and like the complications that can occur if you were to not get your child vaccinated and they were exposed to the disease. Obviously, I feel like it is up to the parent and how you want to, you know, parent your child and what you want to do for them. And I totally feel like that is your choice. So there's the information for you. Obviously, always happy to discuss with anyone, or answer questions if I can, but obviously your provider is the best one to reach out to and really have that full-blown discussion about vaccination. So thanks for listening to Geriatric Mom. I hope you found this episode helpful. Once again, I am on TikTok, Facebook, YouTube, Instagram, and I do have a website, www.geriatric-mom.com. Reach out anytime for support if you need it. Thanks for listening.